Hello and welcome back to Community Conversations presented by the UI Cancer Center. For anyone who's viewing us for the first time, the UI Cancer Center is the University of Illinois Cancer Center at Chicago. We are the state's first community-focused cancer center, and our main goal is to bring cancer information and education back out to the community, and this community conversation is one of our main avenues. With us today we have Laura Belay from the UI Genetic Counseling Program. Laura, would you mind introducing yourself?
Of course. Hi, my name is Laura, and I am a cancer genetic counselor. I work here in the oncology clinic at UIC.
Perfect. So would you mind telling us a little bit about your role in the genetic counseling program and possibly what genetic counseling is in a sort of overall view?
Yeah, of course. So here at UI Health, I function, like I said, as a cancer genetic counselor, which means I work with people from all different kinds of backgrounds who might have a cancer diagnosis themselves, who might have cancer in their family, and who are really looking to find out more information on could they be at higher risk for cancer themselves, could their children be at higher risk for cancer, could their moms, dads, or cousins also get a higher chance of getting cancer. And they come to see us to figure that out and figure out, do they also need maybe more checkups to protect themselves and their families against cancer.
Oh, fantastic. Thank you. And last week we started the conversation on genetic counseling. We got sort of an overview on how genetic counseling is used in the community.
Okay.
But could you talk a little bit more about what, a genetic counselor's in sort of the spectrum of cancer care, where genetic counseling sits, how it's used throughout the process, and maybe give us an example of someone who's used genetic counseling?
Yeah, of course. So someone could be referred to see a cancer genetic counselor, for instance, by their surgeon or by their oncologist. They might have been diagnosed with a cancer per se, like one of my more recent patients who was diagnosed with cancer at 35 years of age, which is pretty young to be diagnosed with the breast cancer. Usually we think of anybody being diagnosed with some pretty general types of cancer like breast cancer or colon cancer under age 50 as people who maybe might have a hereditary cancer or a cancer running in their family. So when an oncologist or a surgeon meets with a patient who was diagnosed, say like my patient was, with breast cancer under 35, their oncologist might send them to our website or give them the phone number for our clinic, and then they would schedule an appointment to come see me.
Got it.
They would see me possibly before they make decisions about their surgery or about their treatment, because finding out that you have a hereditary type of cancer or a cancer that runs in your family might actually change what kind of surgical care you get for your diagnosis.
Got it. And last week we talked about the different types of cancer that genetic counseling is used for. We also talked about, we had the opportunity to talk to Mandra Morgan, who's a medical student who's looking to become a genetic counselor. And what was interesting last week as we sort of started the conversation was in the sort of view of the clinic and how genetic counseling was used. I think a lot of people are sort of wary when they think about genetic counseling, about family history, about how, it affects their family and how they find out about family history. So I guess starting from, the first point, what would you say is the best way for people to find out about their family history and to start thinking about genetic counseling?
Well, I like to suggest sometimes that one of the first things you can do, even if you're feeling a little nervous about us, is just give our clinic a call. I often spend time, maybe 15 minutes on the phone with my patients before they ever meet with me to help them understand what kind of information they could get from their families, what are some great questions to ask different people in their families in ways that might make them more comfortable instead of less comfortable, so that they have the ability to really make their own educated decisions and have the most information possible to protect themselves and their families against cancer.
Fantastic. I actually think we have a caller. Caller, can you hear us?
Hi, how are you?
Hi, how are you doing? Did you have a question?
Yeah, it's a little hard to hear you. So, no cancer in the family.
Okay.
And the question is, I was at my doctor for just a checkup the other day, and I said to him, now, like my father-in-law who passed away from cancer, by the time they found out, it was too late. It was like stage 4, and they tried, but it was just too late. So again, obviously I don't have any family history, but you always wonder, how do they usually find out the cancer when you have the problem? How do you find, a test, or is there anything you recommend to do just for like a checkup, just to make sure you don't have anything? I'm 52 years old.
That's a great question, and it depends a little bit on what types of cancer that you're thinking about, but there are a lot of recommendations out there for what just the average person should do who don't have any family history of cancer, to make sure that they're doing what we call just general population screening. So, for example, men often can start prostate screening with either specialist or just their general doctor. You could talk to your doctor, your primary care physician, about that starting in your late 40s or your early 50s. There are some tests you can be doing to check for prostate cancer. Sometimes you do them once a year, sometimes you do them every 2 to 3 years. Women go every year starting now around 45 and get a mammogram. Those are all ways that women can be protecting themselves, or men can be checking for cancers before anything ever happens, and or you're catching a cancer earlier, like you said, because our goal is really, can we catch cancers when they're in stage 1 or stage 2 before we're really having to deal with what it sounds like your family member was going through. I'm sorry to hear that.
And what, as far as, you talk about prostate cancer, obviously I'm at that age where, yes, they are checking, at a physical. What, and to kind of change the subject, what is there more of in the United States, prostate cancer or breast cancer?
That's a good question, and I don't know the stats off the top of my head for that. Clearly those would affect men versus women, but those are at the top of the list of the most common cancers for both breast cancer for women and prostate cancer for men, which is why we do screening for everybody in the population, whether you have it in your family or you don't, for those particular cancers. Another really important one we didn't talk about is colon cancer. Everyone should get screening for that every year, colonoscopy after 50, and that's one of the few types of screening that actually protects you against getting cancer. It doesn't just find cancer if you already have it.
And so, and I agree with you 100%, but I don't think you do that every year as far as the colonoscopy. So say if they do it every, I don't even know what it is, I've had 2 in my life, and if they got to do, say they do it every couple years, but what if, God forbid, you start, a cancer tumor starts now, and don't have my colonoscopy for 2 years, isn't that a problem?
That's a good question, and that's why you work closely with your doctor, and those checkups or colonoscopies are different for everyone. You're right. Very high-risk patients, like the patients I see in my clinic, they do get colonoscopies every year, but you're right, general population, sometimes you don't get them more than once every 10 years, and that's often determined by things like we do in our in our clinic, like determining, do you have other people in your family, do you have any personal risk factors?
Right. Okay, great. Thank you very much for your information.
Thank you for calling.
You're welcome.
And,
okay, bye.
Of course, a lot of this information, if you're looking for specific statistics about cancer or any specific details, you could always find on the Cancer Center website at uicancer.uillinois.com, or the Genetics and Breast Cancer website, which I believe we have here. And here, I think you can look, and this actually leads well into our next question, and I think he alluded to it a little bit, but who sort of who do you think would benefit from genetic counseling, just sort of things to look out for to maybe start the process of thinking about it?
That's a great question, and like you're showing right now on our website, there's a very simple bullet point list of things that anybody, if they're seeing in their own family, should be able to call a specialist and talk to someone about if they need a hereditary or a genetic evaluation for themselves or their family. But the really simple rule, since that is even a long list right there on the website, is if you're seeing multiple cancers in your family or young cancers in your family, so under age 50, then it never hurts to just bring that up with your doctor, talk to your family members about it, make sure that you have all the information you need and that you're providing that to your doctor.
Fantastic. And I think on this website they also have a general description of some of your services. And I know when we had talked offline a little bit before, the program, you had said that right now the website is focused on breast cancer, but that you've expanded out more into other cancers. Could you explain that more?
Yeah, so our hereditary or genetic program here at UIH actually now, it covers all kinds of hereditary cancers. So if you have people in your family who are getting cancer at a younger age, under 50, colon cancer, breast cancers, prostate cancers, or if you have a lot of different cancers in your family, you can come see us for evaluations for any cancers, not just breast cancer.
Fantastic, thank you. So also thinking about sort of familial risk and the difference of, how can it change how you approach cancer. We were thinking about, as a team, some personal stories. I personally don't have sort of a family history of cancer, but I know one of our colleagues does have a family history. He recently found out that many members of his family had suffered from breast and ovarian and prostate, lung cancer. What would you say would be sort of that next step after finding this family history, how they should move forward, other than possibly just, calling you as a genetic counselor? What are the sort of, processes they should go through when thinking about cancer in their own life?
Absolutely. So just like you said, you're more than welcome to call us directly, give us a call on the phone, and talk a little bit to us about if it's cancer in your family that we would be more worried about being hereditary or something that passed through your family. You definitely could also present that information to your general doctor. For women, that could be your gynecologist. For men, it could be your primary care physician. Present that family history to them, and then they can refer you to someone who maybe works with your insurance or works at the hospital that you're already comfortable at.
Right. And even thinking about that next level, what do you think, does it apply differently to different minority groups? I know our clinic population is predominantly African American and Latino. Should there be a sort of different way to start thinking about genetic counseling in that way?
So I like to think also that this kind of getting this information out is really important, that we're all talking to people in our community about it. And so wherever you find your community is the best place to start talking to people about this. So whether it's at your church group or a support group you're in, or a book club, or anywhere else where you feel comfortable in your community, is one of the best places that you can start getting the word out. Also, when we're thinking about family members, it can be really great to get some of this information that you might be not know already who's had cancer in your family at family events, whether we're talking Thanksgiving, or if your family gets together on Sunday for dinner, or whether you're getting together for a holiday, or even at a funeral. Places where you can be with your family and start asking questions to make sure you're taking care of yourself.
Fantastic, thank you. And so I think sort of to take the next steps about genetic counseling, do you have any sort of general success stories, or things of your own work, some examples that can show people sort of the benefits of genetic counseling and how it's been used so far?
Yeah, absolutely. One of our big goals in cancer counseling is that we see families who come in and see us, and they might have 3, 4, 5 examples of a cancer in their family, cousins, aunts, grandmothers that have had cancer. And if we can find an answer for why those family members are getting cancer, a genetic change or an instruction that's broken in their family that's getting passed down through generations, and we can start getting the next generations, if we're talking about daughters or nieces or granddaughters or grandsons for that matter, getting them more checkups, we can actually see less cancer diagnoses in those families, or we can see those cancers caught earlier, so people have the ability to spread that word in their family and actually protect people. So going from family histories where we see 3 or 4 or 5 cancers to in the lower generations where we're maybe only seeing 1 or 2 or none at all.
Fantastic. Yeah, and I think that's important, thinking forward, that genetic counseling is very informative, for you personally, but thinking about farther down the line, the more you understand about cancer, the more you can teach, disseminate out into your community even, and, thinking about it positively yourself can influence not only your family, but, other people how they think about it, and then hopefully down the line we're, again, seeing a lot fewer cases of cancer, just from an education standpoint. Once you understand it and you're doing more screening, hopefully you can have a better effect down the line. So also, again, I guess moving forward, what do you think right now is the genetic cancer program or the genetic counseling program working with programs across campus? Do you have any sort of clinic presence? Where can they find you guys, other than just calling you or going to your website?
Yeah, great question. So we work very closely with the oncology clinic. So we work with quite a few of the surgeons, a lot of the oncologists. I'm directly in the clinic with the people who are getting chemotherapy and with the social workers, because our patients are seeing all those different providers. So really talking to any of your doctors, if you're going through a cancer diagnosis right now, they can help you find us.
Great. And do you take, if someone had a question, is the best way to call you, or, could they come right into the clinic and see you, or?
Great question. So it might be a little hard to find us in the clinic just because we're usually with patients, but yeah, absolutely. We take calls directly to our office because hereditary genetics can all be kind of confusing subjects, so we're more than happy to answer anybody's questions anytime.
Great. So could you also, we have a couple diagrams here, just thinking about, what a typical genetic counseling session looks like, how you walk someone through their family history, what they can learn from it, and also maybe walk us through what this sort of diagram means, what people can take from it.
Yeah, absolutely. So right here you see 5 different examples of families who might have visited with our clinic in the past. One of the most important things about genetic counseling is we help you understand or assess if we think the cancers in your family might be something hereditary or something running through your family. So we can see clearly in family 1 or 2, those patients might say, well, I have some cancer in my family, I'm kind of worried about my own risks, but our patient in family 2, we can see right there with the arrow next to her, who's never had a cancer before. She comes in and says that my mom had a breast cancer. So we might talk her through it and find out that all the other people in her family have gone without cancer, and her mother was older when she got cancer. So we actually would be able to tell her that we're not too worried that she would get a hereditary type of cancer, and she probably doesn't need more screening than the average woman. Now in comparison, we might have families that come in and see us, like family 5, who've had 3 people in their family with breast cancer, and we find out that even if they've never had a cancer before, that they actually can carry a hereditary syndrome that many people are familiar with, called BRCA, or the breast cancer gene, and maybe we can help this woman right here before she ever gets cancer to go ahead and get extra protections for herself.
Fantastic. And when you're meeting with people and they've either been navigated to you or they call and ask questions, do you also navigate them to other types of resources, or looking at those different family members? Do you, from your genetic counseling, navigate them directly to care or directly to screening? How does that process work?
Absolutely. So once somebody is in our high-risk program for whatever type of hereditary cancer they have, we really help them manage, sometimes for the rest of their life, what that means for them and their families. So we might see a patient, and pretty soon her sisters, her brothers, her cousins all are part of our clinic. And for every individual patient, we kind of take the burden off their shoulders of any extra care they might need. So we help them schedule their appointments. We make recommendations. If you need extra breast screening or colon screening, we help send them to the right people and help them keep track of how many appointments they need a year, what those appointments look like, and talk about some of their results when they come back with them.
Great. And even thinking about, and this might, the family connection, cousins, siblings, some people are spread across the country. How do you sort of deal with that family dynamic, or, do you navigate them to genetic counselors in their area, or?
Yeah, that's a great question. Lots of times I'll have a patient who said, I'll recommend that their brothers and sisters all go out and get testing for the hereditary syndrome that we just found out they had. And I always recommend that they give me a call, and I can help them either come see us or see someone anywhere in the city or anywhere in the country that's closer to them or more convenient. Because the most important thing is that everybody in the family is just getting the screening they need, wherever that is. Believe it or not, genetic counseling is a smaller field. So we actually have resources that allow us to find every genetic counselor in the whole country. And actually, patients could go online and find that too at the National Society of Genetic Counselors website. You can actually go online right there. It's a free website, and you can load in the town that you live in, or maybe even the hospital you go to, and find a genetic counselor that either works in cancer or pediatrics or prenatal, whatever might be helpful for you and your family.
Great. And I mean, even think about that. It's a small field, but it sounds like it's spread across the country. I know before I started working at the Cancer Center, I have not heard much about genetic counseling. Again, I don't have a particular family risk of cancer, but I guess my question is sort of, even though it's widespread, is it also growing? Like, are they, what are the goals for genetic counseling in, in hospitals? Do they want to have genetic counselor in every clinic, in every, do you know where it's moving in that direction?
Yeah, that's a great question. And you're right that genetic counseling is more rare because in general most hereditary syndromes are rare, but most cancer centers now in the United States, that especially big centers like UI Health, are going to have at least one genetic counselor or 2 or 3 like we have. But yes, you're right, most hospitals now have at least one genetic counselor.
Great. Fantastic. It's good to hear. And again, if you have any questions about UI Cancer or the genetic cancer program, you can always go to either of our websites. I'll pull up the genetic counseling website again. And again, even though this website is focused on breast cancer care, it is spread to more cancers, different focuses as well. And if you have any general questions or need any information about the Cancer Center, you can always contact, let's see, pull it up here, the UI Cancer Center at this address and information. And I guess one of our final questions is if people did have direct questions for you, the best way to contact you, I assume, is through your website and through your phone.
Yep.
So I guess the final question, thinking about how genetic counseling is sort of in the community, our goal as a cancer center is to always disseminate information and education out to our community to make sure as many people as possible understand cancer and understand sort of their personal risk for cancer, their family risk. What do you think the best way, as a genetic counselor, the big thing that the community can take from genetic counseling, and sort of a final remark on how the community can use it?
And I would say really to just say some of the things that we've already said is that to talk with people in your community and people in your family about what's going on. A lot of people in general can be afraid to talk to their family members. We hear a lot of patients saying, my family members never told me about their cancer diagnoses until I was diagnosed, or this is something we just didn't talk about in our family, because it can feel very private. But the best way that you can protect yourself and your family members is to talk about it, to talk about who's been diagnosed with cancer, how they were treated, because that really can be very helpful twofold. It can help patients both on the support side to know that they're not alone and to know that people they love have been through this, whether it's somebody at their church or at their school or in their family, and also because it really affects if this could be something hereditary running in your family, if you know about who's been diagnosed with cancer in your family.
Right. And again, it affects all members of your family, both men and women. I know we were talking before the program that overall, to engage more men in the cancer conversation is very important.
Absolutely.
And to even at this next level, genetic counseling, to get the conversation, everywhere. Men also need to start having this conversation, understand that, there's no aspect of cancer care or clinic care that is, family specific. I think it's important for everyone to understand, everyone to know about, so that, you can teach yourself and your community.
And I think that's a really good comment. And just to add to that, I think sometimes what we forget when we think about things being hereditary is even if it's something hereditary that usually affects women, like breast cancer, that can equally pass through men and through women. So you can equally get that risk from your father's side of the family or your mother's side of the family. And that's why it's so important that even in high-risk syndromes like in breast cancer, that we're talking about these things with the male counterparts in our family too, and that there's plenty of hereditary syndromes and cancer risks associated with male cancers also.
Right. Do you have any just sort of last-minute examples of that sort of relationship?
Yeah, absolutely. So we see actually a good number of men in our clinic that are coming both for genetic syndromes that can cause very high risks of colon cancer, and I work with a few patients who are very large sibships of just brothers who are definitely all coming in to see us because of hereditary syndromes they have.
Fantastic. Again, so we have about a minute left. We'll be wrapping up. But if you have any questions about genetic counseling, you can go to their website, which I'll pull up one last time. I believe your contact information is on here, your location at the outpatient care clinic at UI Health. If you would like to contact the Cancer Center at all, here's our information. You can The Cancer Center does cover sort of all aspects of cancer. If you have any questions whatsoever about screening, education, community engagement, please contact us at this information. And we will, give you as much information as we can or navigate you to the best party that can help you. Thank you very much. This has been Community Conversations with the UI Cancer Center.